Thanks for staying with us. Joining us on the show is the Coordinator, Mental Health Desk, Lagos State Ministry of Health, Dr. Tolu Ajomale, and Mrs. Stephanie Adams Douglas of I Choose Life Foundation. They will be discussing mental health and coping mechanisms among young people. Welcome to the show, sir.
Thank you very much.
Welcome, ma'am. I hope she can hear. So I would like you to tell us what mental health is break it down for the layman out there to understand what's about.
Right. So usually when we have conversations around mental health, people usually think about people, roaming the streets in tattered clothes and things like that. But generally, I like to say that everyone exists on a spectrum, right, on a mental health. You either have very good mental health or very poor mental health. And at every point in time, we're moving around that spectrum, depending on the things that happen around us. Environmental issues, social issues. That kind of pushes us back and forth along that spectrum. So it's all about, our ability to be able to actualize our life dreams, be productive to the society, and be happy, essentially, and being in a state of well-being. So when we speak around mental health, we are speaking around the well-being of the person. And there's a very common mantra that is, there is no health without mental health.
So mental health simply means when you are okay.
Yes, psychologically, emotionally,
every
you're
aspect.
in that balance, yes.
All right, go ahead.
Okay, you mentioned when people hear mental health, they just think you're out on the streets and things like that. And really, that is one of the reasons we don't even want to have that conversation in our homes or in our schools, because just to say to someone, maybe you need to see a therapist, like, how dare you? It's like yes. Insulting someone. So I think the question is, although I'm seeing a lot of it lately, is how do we have these conversations and make it normal to have this conversation and understand, oh, it seems like I need to check my mental health. I'm tilting towards this side. What do we do?
Right, so I think last couple of months or year has actually raised that conversation a lot more. On social media, a lot more people are talking about, oh, I need to check my mental health, yes. Or I need to get into my mental well-being. And it's a good thing because it's one of the things that we've been hoping to achieve, to normalize conversations around mental health, for everyone to understand that there's a part that they all have to play in their lives to make sure. And I think part of the reason why that became one of the topics on the forefront was because of the isolation, the lockdown. People were now in their own space and they were seeing themselves, and there was a certain sense of self-awareness. And they began to understand that there are certain things they were dealing with that they had totally ignored because, there were a lot of distractions with work, with our social lives, but all of that stopped, right? And then we're able to confront ourselves, look ourselves in the mirror, and then ask questions like, am I really happy? Am I in a good place? Is this me? Are my relationships working, right? Because it was in that same period they had a lot of incidents of domestic violence, people dealing with all kinds of issues, So it is a good thing, that we're in that space now. And a lot of people have begun to have those conversations. We have a lot of advocates that are speaking up, a lot of non-governmental organizations that are trying to, create awareness around the importance of taking care of your mental health and making sure that you have positive, mental awareness or mental sense of self. And that when you don't, you know that, you need help, right? And then there's someone you can always talk to for help. And like, I said earlier, part of that conversation is changing the whole narrative about recognizing that mental illness is not just, schizophrenia or people roaming the streets or that whole Yaba left concept. And there's something that I usually hear with some of our specialists that if you check it, there's actually more madness at Yaba right than there is at the Yaba left that we always talk about. So understanding that, and creating more awareness, more information around it, that there's a wide array of issues when we speak about mental health. Anxiety, for example, depression, so many issues from childhood to when we get really old are part of the conversations we need to have. So increasing that level of literacy amongst people so they understand the whole, gamut of the spectrum of mental health.
Yeah, so I personally believe, Waike, I'll come to you in a bit, that almost everybody in Lagos is mad because the level of stress in this city, you're driving on the road, the way the bus riders, in fact, you see well-dressed young ladies coming out to throw punches with bus drivers. And I'm wondering, wow, do you ever think that for a city like Lagos, we can get to a point where people begin to take note and take care of their mental health?
Yes, I think we can. So like you mentioned, understanding that there are a lot of stressors that exist in our society. And I think it's not just limited to Lagos, but a lot of urban societies are under that pressure of trying to, you know, achieve your life dreams. And then you're meeting with different kinds of people on your way to work, right, on the road. And especially in a city like Lagos, where we have a lot of traffic. So there's that pressure of, you know, waking up really early and then spending hours before you get to work, and then dealing with the stress of work, and then spending hours before you get home, and then you don't even get enough sleep at night, and then you're all into the whole cycle again every day. At some point, we will tend to break, right? The stress level will pull us and make us begin to react. So a lot of the things that we see on the streets are not necessarily triggered by that particular incident, right? But it's a combination of all the pressures and the stress that they've had to deal with every single day. And that point in time was just an outlet for them to begin to... So sometimes you wonder, you ask yourself, what really happened just now? And then the person got out of his car, took a bat, and smashed somebody's windshield. It wasn't really because they were struggling to get into somebody's space. It was a lot of pressure. Either dealing with, you know, relationship issues at home, children are going through certain things in life, you know, and all of that. So there are so many stressors. And an urban society is a huge trigger in itself.
Let's take a short break. The conversation continues when we come back. Stay with us.
Stay tuned. Your View will be right back.
Thanks for staying with us. So I have a question for Mrs. Stephanie. Can you hear me, ma'am?
Loud and clear, I can hear you.
Okay. So in your line of work, so I know that you have a foundation that you help people with mental health issues. What would you say are the statistics of people in Nigeria that have mental health issues?
At the moment, right now, we have over 60%. That's the statistics, yes, over 60%. And when I talk about mental health, we're not just talking about people who are roaming on the street. Like you said earlier on with Dr. Ajomale, not people who are literally throwing stones at people. We're talking about little things, quote and unquote, that people see as anxiety, depression, and so much more. A lot of people are going through a lot in their daily lives, especially young people. However, we have chosen to just take it as a slight thing or a normal thing. You know, every day people are talking about, oh, I feel bad, I'm so anxious, I feel depressed, talking about their work environment, talking about so many things, and even how the climate itself here in Nigeria makes us feel a little bit stiff, you know. But we have all just taken it as a normal thing, which is unlikely. And talking about that, we have come to realize over the few years that a lot of people are focused on adults or, you know, elderly people. But there are few foundations or few people who are talking about young people between ages 14 to 25, because that's a critical stage. That's a stage where a lot of young people are dealing with coping mechanisms. That's a stage where a lot of young people are exposed to so many things, be it in secondary schools, in high institutions, you know. And I literally took interest in mental health when I was a teenager, considering that I got to realize that there was little or no intervention for young people except for medical interventions, you know. So we thought a support system is important for young people. A group is important for young people where we can actually just focus on this demography and give them the support that they need.
Thank you.
So you say 60%. So that means at this table, one person.
All of us.
Yeah,
One person is very large.
All of us, Waiki. All of us.
No, they say 60%.
No, all of us.
We are 4 now.
All of us on this table, Waiki.
You know, the interesting part of it.
I'm just thinking, since most of them are very large, what is the solution? Really and truly, because we all go through the stress of the traffic. I think it's mad. The way we even cause the traffic is madness. What is this? How are we going to find this solution? Because Dr. Ajomale here says there's a solution. He has not convinced me there's a solution yet. Please, convince me.
Stephanie, are you there? Okay.
Oh, I'm right here.
Okay.
So, you know, the thing is, a lot of people don't believe there's a solution because they are not willing to open up. And that's because, yes, we live in a climate where a lot of people use your situation or what you're going through to make jest of you. We have seen that in several occasions, you know. But we can start by a support group, having to speak to a psychologist, a professional, and that's why we have people like Dr. Ajomale. At I Choose Life Foundation, we work with a lot of professionals, psychologists, psychiatrists. Of recent, we signed an agreement or a partnership with the Karu Psychiatric General Hospital, you know, where we get a lot of young people that are going through a lot. In fact, we had a situation where a young child actually told his mother that a close friend or a relative, rather, has introduced him to some substance. And, you know, because, and that's on another level, you know, but the mother never believed him because she thought, oh, no, it's something like that could not happen. And it did escalate to a level where we had to intervene. Of recent, we saw a lady here in Abuja, a young lady who was absolutely misusing drugs, and we took intervention. The thing is, we can start with these conversations, and that's what we are doing. We are trying our possible best to change the narrative. We're trying our possible best to let people know that it is not normal for you to feel depressed. It is not normal for you to feel a long-time anxiety or to have long-term anxiety. You can speak to a professional. You can speak to someone. You will be so surprised that a simple solution would be speaking to a professional, vetting out. Because it takes a lot when you vet out. And when you do that, there is a lot of, it's like you've taken a log out of your heart or out of your chest, you know? So you're already seeking or you're already finding solution by speaking to professionals. And one of the reasons why we're doing this is because a lot of young people are actually being celebrated for so many things in the entertainment industry, in the sports industry, but you do not know what they are going through. Recently, a sports athlete who was at the Under-20 World Championship in Kenya shared his experience about how he was injured at the last stage of it, but because he wanted to make Nigeria proud, he had to take that. He had to take that in. Do you know the brevity to do that for your country? You know, and in the course of our conversation and our work as a foundation, we got to find out that this person literally sacrificed for his country. What do? We need him to speak with a professional. We need him to speak with a psychologist, because you never can tell the effect that will have on someone's mental health long term.
All right, Stephanie. Miriam.
You know, I just like, you know, where we're going with mental health and children. I was mentioning to you off camera that recently I have this great passion for child psychology, and I've been taking some online courses. And sometimes I feel that, and in doing that, it has opened my eyes that if we handle or introduce children to therapy and psychologists early, it would help with some of the issues like in their teenage years and adulthood, and even maybe the whole of, like a state like Lagos, where because of the stressors being an urban center, you know, it will just have you act a certain way or respond a certain way. If we are open to mental health interventions early enough, do you think that that would affect us in our adulthood?
Yes.
Positively?
Usually, we usually say that, so there's this term that they use in psychiatry about plasticity. So it refers to the developmental time, you know, in the child's life where he's trying to understand his emotions, right? So we understand that a lot of the trauma that happens in childhood has an impact in later on in life. And that's of people who are much older, if you really do your thorough interventions and you go through the psychotherapy that the patients usually would, are asked to go through, a lot of the fundamental issues that have evolved into mental illnesses in adulthood had started from childhood. So helping children to understand their emotions, helping children to learn coping mechanisms is part of the things that will help them have a resilient mindset as they get older. So the two things here now, there's on one part, you want a child to understand what it means to be angry, why they're angry, be able to express or say why they're feeling that way. When they're happy, express why they're feeling that way. But also when they're feeling those negative emotions, to learn what to do to come back to a neutral point, right? And coping mechanisms is one of the triggers that leads to the use of substances as they grow older.
Yeah, so you are the... Because I'm about to let him go. But I want to go
before you let him go, please, before you let him go, doctor.
Yes, ma'am.
I'm frustrated. NEPA, gas, traffic. Should I name more?
No, we know there are plenty.
I'm frustrated. All that one is trigger. Please, what's my solution?
Coping mechanism.
So, like how we've had this conversation now, you've been able to talk about it and we've been able to laugh about it. It doesn't take away the problem, right? We still need to fix the issue that is causing the trigger. But how you respond to those stressors is what we're trying to address. Okay, so yes, there's power failure. Yes, you have to deal with traffic. You have to go to work. You have to do so many things. You still have to do those things. But how do you deal with them? How do you cope? How are you resilient in moving through while you're trying to find the solution, while you're trying to achieve your life's
My
dreams?
brain sometimes is screaming.
Yes, I want to ask you are the coordinator of the mental health desk in Lagos State. What exactly is your responsibility and how have you helped people in Lagos State?
Right, so I think we're quite pretty wide, and I think I'll just summarize that in a few because we really don't have a lot of time. The state is constructing a 500-bed psychiatric hospital with a 1,000-bed rehab facility to increase the number of services that are available to Lagosians. We're also trying to integrate mental health into general hospitals and primary health facilities so that people don't feel like if they need to see a therapist, they have to go to Yaba, and then when they're coming out, they say, I know what you went to do there. But if you walk into your general hospital or your PHC, anyone can go in there for anything, right? So it takes away the stigma associated with that. We also launched a helpline so that people don't even need to come in, right? They always have someone that they can talk to, a counselor who is available, to provide help to them. Social media, there's a lot of work going on there as well. And just trying to create as many outlets and network with as many people like I Choose Life, right, who are also doing incredible work in communities to be able to expand the knowledge, expand the awareness, create that advocacy, and availability of services for people.
Thank you so much, Dr. Tolu Ajomale and Mrs. Stephanie Adams-Douglas. Thank you. I'm sure we've learned something from what you have shared with us today. And that's a wrap on this segment. The show continues after this break. Stay with us.
Stay tuned. Your View will be right back.